You can reach me at area code 309-648-5351, or you can email me at dunamis1 at netzero.com. We'll go right into the seminar today, and we want to discover why healthcare planning is not just and solely for the elderly. And when we're talking about that, we're talking about extended healthcare planning. Many individuals wait until they become a certain age before they start considering what would happen if something happened to me that I couldn't engage, or I couldn't get around, or my life, the quality of my life is suddenly and mysteriously changed. My prompting for this particular seminar actually began, like I said, I've been in the business here from 25 to 27 years. I've written plenty of insurance to protect families and different things like that over the years. But it really hit home for me recently when my spouse was ill and had to have surgery. And with just a couple of twists there, if the Lord hadn't blessed, things could have went very dramatically wrong one way. But we were blessed. But I thought about the worst case scenario, or a scenario where our lives are dramatically changed. I thought about the impact that that would have on our children. I thought about the impact that that would have on me. I thought about our schedules. What would we have to do? What would I have to do? What would I have to stop doing? What would my children have to stop doing and or reconsider if something happened and there was a situation to where um, the quality of my wife's life changed dramatically? That would affect all of us. And so at that particular point, not considering that I'm not old, but at that particular point, I considered, this is not just really for those who are elderly. It's for many of us along the way, and many of us at any age along the way of this life. And I believe the statistics and different things that you'll hear during the course of this seminar will bear out the fact. And I hope that you'll hear those things loudly and clearly as we go into this subject matter. First of all, let's deal with the issues. Very important for us to know, and very important for us to distinguish the difference here and deal with our terminology first. We're talking about chronic and critical illness and how those things can irreversibly change our lives. And first thing I want to do that's different than maybe in some of the other seminars that I've done here, I've kind of added information as we go here based on some of the response that I've been receiving as we've done these seminars as well. So I appreciate your response and input. And for those of you who do have questions on anything that we've talked about, there's a chat box on your screen, or at least there should be one there, uh, where you will be able to write in or type in your questions as we go. And then after that, after I'm finished talking, which I don't intend to talk the whole time here, but after I'm finished talking, I intend to open it up so that you can actually ask your questions live and on air. Okay, but let's talk about the difference between chronic and critical illness. Now, I want you to understand a critical illness is a life threatening condition. Critical illness is a life threatening condition such as stroke, cancer, heart attack, coronary artery disease, etc. That is a critical illness. Okay, that's a life threatening disease or a life threatening condition. Now, a chronic illness is differentiated by the fact that a chronic illness is a condition that generally lasts longer than 3 months by definition of the governmental definition anyway, and a condition for which there are no known cures. And that particular condition will further lead to a lower quality of life and probably invoking or impeding the use of what's called the ADLs, or activities of daily living. And we'll go into that in just a second. When we look at chronic illness, some of the most popular illness are stroke, heart disease, heart attack. Of course, there are heart disease accounts for 1 in 7 deaths in the United States and remains the number one cause of death in the United States, according to the American Heart Association, American Stroke Association. Strokes are responsible for 133,000 American deaths, and the second leading cause of death globally. All when we talk globally, just more in the United States, but globally, stroke is a major cause of death. Surprisingly enough, even in the age of scientific improvement in medicine and all of that, stroke is still the number one leading cause of long term disability within the United States. And it's that particular part, the chronic illness or the critical illness of stroke, then goes into the chronic illness or the chronic condition, which many people are not prepared to address. Just looking at stroke, for example, when a person is disabled as a result of stroke, has to rehab to get their life back together, if they will ever get it back together. What has to happen? Sometimes there's care that has to happen 24 hours a day. Sometimes there's people that need to come in and out of the home. Sometimes an individual, because of the lack of resources or whatever, has to go to a facility in order to rehab, or in order to, be taken care of. I met individuals, and surprisingly enough, when we talk about extended health care, and this is something that many individuals have just said in the insurance industry is long-term health care. But when we talk about extended health care, or health care that has to be given to individuals on a regular, full-time basis for any duration of time, the number one age group that's receiving extended health care are the individuals from 18 to 64 years old. I'll say that again. The number one, the largest group of individuals receiving extended health care in the United States are individuals from 18 to 64 years old. This means, unlike the common perception that only older people, and I'm sorry to call those of you who are 65 and over, listen to me, old, because you're seasoned. Let me say it like that, because I'm on the way. I'm going to try to catch up. But if we look at it, we'll understand that it's not just when we have 43% of those individuals that are under that particular age, and we have a little bit over half that are over, then we need to understand this is really kind of a balanced situation. Okay. And stroke is one of the leading causes of that. And in the last couple of years, according to the CDC, incidents of stroke have risen in the United States population. Now, there's some debate over whether that is because of diet, routine, whatever the case is. But especially in ethnic groups such as Black and Hispanics, there has been an uptick of stroke that has occurred. And therefore, there are many more Americans that are suffering as a result of stroke and these, what we call, or what we're terming as chronic illnesses. Okay. So this is a very real situation and something that happens regularly. Let's go on to the next point. When we look at the importance or the financial drain of chronic illness, the gentleman named Ken Frazier, who is the head of Merck Corporation, said the real cost of healthcare in the healthcare system is chronic illness, things like diabetes, things like Alzheimer's. Now, he's not talking about just the initial point of diabetes. There's a diabetes, and that is basically a critical illness, critical illness in and of itself. That if left untreated, it could be life threatening. However, thank God for good treatments that cause diabetes. Many people can live with diabetes. However, diabetes out of control is a chronic condition. Diabetes out of control will cause a difference or a change in the quality of individuals' lives. And so, this is the main drain on healthcare itself. When we talk about healthcare, this becomes the main drain is chronic illness. This is where the money goes. This is what costs so much time, and this is what costs so much attention. Chronic illness, and is recognized within the healthcare industry as a problem. It's the number one cost associated with healthcare. Now, so far as from an insurance perspective, which I'm here to talk about today, chronic illness insurance is identified or basically triggered. And remember that word trigger. We're talking about benefit triggers. Is triggered by the inability to perform about two or more of the seven common ADLs. And remember, we talked about ADLs before. I mentioned that earlier. Activities of daily living. Well, let's look for just a second at what the activities of daily living are: eating, bathing, transferring, continence, dressing, ambulation, and the ability to remember or dementia. Now, some of us feel like, hey, we've lost the ability to remember already, so we would qualify. But the having two inabilities out of this particular list would cause a person to be considered, or cause the medical profession to consider a person chronically ill, except for the last one, which if a person is has dementia, Alzheimer's, that is either life threatening, where a person is a threat to themselves or a threat to others because of their Alzheimer's. If a person enters that realm, they are considered to be chronically ill, period. Even if they can eat, bathe, transfer, continence is fine, and they can dress themselves and they can move around. So, dementia by itself, having dementia, is considered to be a chronic illness that triggers or makes a person fully chronically ill. And we can remind ourselves of that, or kind of visualize that if we've seen news reports in just about every section of the country where some of our older people, or some people who have Alzheimer's, have walked off and left either facilities or homes, and they don't know where they are. They've been found later. Some of you may have had relatives that you've cared for that type of thing has happened. Some individuals start to make food, and they go into another room and never come back, and the food is on the stove cooking, and they end up starting a fire. Many people end up killing themselves, or burning down their house, or running into significant problems because they forgot. Their mind was not fully together in order to remember what they were doing. So they became a threat to themselves and a threat to others, even by their actions and things like that, which is as a result of this chronic illness of Alzheimer's or some form of dementia or mental incompetence. So these are very important situations. And as I said, if we think about things through our family, we can see where sometimes it may be the case where we have a common experience with these sort of things. With that said, one thing that seems to exacerbate the problem is that Americans are living longer. If we look at it, just from 1980 up until now, we'll see that the life expectancy has increased dramatically. For men, now up to 76.3 of age, up 7% since 1980, and women up to 81.1, which is up 6% since 1980. And what we find out with that is that more than likely, the individuals that are going to need some form of extended health care access or coverage are women by far and large. And so women become the primary age group to really kind of discuss their extended healthcare needs and expectations. So it's very important. So we're blessed on one hand to live longer, but living longer does come with a cost. And as I point to here, 79% of women over age 65 will require some form of long term care services during their lifetime. Over 40% will need care in a nursing home for some period of time. Now, I may be talking to quite a few young people today, and some of you have younger families, kids are still in school like mine. However, uh, the mistake of talking about these things when we are old is that, or when we are older and think, okay, well, I can talk about them now that I'm older. The mistake is that when we talk about those things at that time, sometimes we're restricted either by health or by finances on what we can do to address them. So I am encouraging each individual, if you have a family, even a younger family, to, or if you're part of that, or if you know individuals that have a younger family, begin to help them start thinking about these things now. They can address these things early on and it'll be taken care of because, as we'll find out, these things, extended health care, could have a very devastating financial drain on everybody and for individuals, no matter what income or what age they are at. There's a financial cost to extended health care that maybe some of you have not considered. But let's just deal with some averages here for a second. According to industry statistics on savings and finance, the median savings for an individual or family earning about $50,000 a year is about $63,000. So, an individual or family earning about $50,000 a year, which is a very good living, will only be slightly over what they're earning, $63,000. That's good, but let's take a further look. According to Fidelity Investments, the average 401k balance in 2016 was about $92,500. At this particular time that I'm writing you, we're just coming off of the fourth worst stock market drop in the United States. The market lost 799 points yesterday as I'm speaking in this particular broadcast. Now, it could change this particular presentation. That could change. The market could go up tremendously tomorrow, although it could go down as well. And there are many people who their only savings or their only earnings are tied to their 401k retirement plan or to the market in some type of way. And so it becomes a volatile environment to seek or expect money to your financial future to hinge on the rise and the fall of the stock market. But even that, the average 401k in 2016 was only 92,000. The average balance was only $92,500. And according to the National Care Planning Council, the average nursing home stay is about $835. Guess what? The average stay from coast to coast at about $200 a day costs about $167,000 to $170,000 just for the nursing home portion. What does that mean? Let's look back at that $50,000 wage earner who has about $63,000 there. There's not enough money to go around for the average stay. Most days within a extended care facility are preceded by a stay at home or by a stay in some other form, to where, there has to be funds, there's some type of insurance, or there has to be funds out of pocket to pay for. In other words, the nursing home stay is really kind of like the latter part or the last thing that happens. So it could very well be 167,000 plus. It depends upon how long the stay and the illness has extended. But 167,000 plus, all the way up to 300,000 or so. The longest stay in the United States right now. The longest extended healthcare issue has gone over 20 years. It's still going. Over has exceeded 20 years. So one cannot say how long one will need care or how long one will need help. The quality of help is what I'm focused on today as well. As we'll see in our next uh, presentation, or part of the presentation, is that when we think or assume that the government can intervene and help our stay or give us or take care of the financial expense or help fray financial expense, we could be wrong. And I'll tell you why. There's a problem with government intervention. First of all, there is a program that is a, what I want to say, a fail safe, called Medicare Part A and also Medicare Part B. Now, most individuals don't qualify for Part A until they're age 65 years old. Now, there is a way to qualify for Medicare, and that is that a person has to have a extended disability for at least 2 years prior and receive SSI for those 2 years. So a person under age 65 can receive Medicare Part A under those conditions and or circumstances. But even that, Medicare Part A will only allow for part-time intermittent care and not full-time care. And they'll also do that on a limited basis of 100 days, or they'll do it for a limited basis of 100 days for full-time care. Listen to this. Medicare supplements don't fill the gap. There's all kinds of Medicare supplements, and Dunamis Insurance and Business Services, we do provide Medicare supplements as well. But Medicare supplements do not fill the gap. They do not provide this full time, ongoing, extended health care coverage. They just fill in the gaps between Medicare Part A and supplement what gaps that are left from Medicare Part B as well. There is another program administered by the states. In most states, there's a Medicaid program or state assistance program, but that is geared toward those who are of low income and of modest means. However, anyone can participate in the Medicaid program if they are willing to subject themselves to spin down. Okay, what is spin down? Spin down accounts for your assets. Under Medicaid, under most rubrics, cash assets, including retirement savings, must be utilized first. That means you've got to use your dollars first in order to qualify for the Medicaid program or Medicaid coverage. And in most cases, individuals can only retain about a $2,000 cash savings and a primary residence and modestly valued transportation. In other words, you're not going to have a Bentley in your driveway or a Tesla and say that you're on spin down. Now, that may be arguable. There may be some attorney that listens to me and said, hey, well, we can do it. Well, more power to you. However, Medicaid requires an individual to go through spend down. So let's think about that savings account that you had at earning $50,000 of about $63,000 in there. Guess what? That savings account or retirement fund has to be subject to Medicaid or has to be used to offset your costs. It has to be spent before Medicaid will step up. So we've already seen that Medicare won't cover full time, and Medicaid will only come into place if you have a low income or if you're economically impoverished. Okay, so there is a problem. What about those who are not economically impoverished? What options are there? And this is exactly what we want to address today in this seminar. Let me go a little bit further here. Um, those are the issues. Let's look at some of the facts surrounding those issues. Listen, as I stated earlier, and to kind of reiterate the point, nearly 41% of long term care is provided to people under age 65 who need help taking care of themselves due to, due to diseases, disabling chronic conditions, injury, developmental disabilities, and severe mental illness. Listen to that. Need help, people under age 65 who need help taking care of themselves. And as I said earlier, we can't count on the government too much. Why? Because Medicare Part A only covers 100 days of skilled nursing care. But care must be received where? In a nursing home facility and not at home. Now there are waivers that people can have and file, and everything I'm saying here, just about in this presentation, there is some type of waiver that can be filled out. But you need to think about what you have to give up in order to get that waiver. But most care is given only 100 days, and that has to be done at a facility. Non-chronic skilled nursing home care must be preceded by a 3-day hospital stay in most circumstances. All right, so there are options. How will you be taken care of? And this is what hit me. How and who, what arrangements will have to be made if a chronic condition struck your family or an individual within your family? You've been responsible for taking care of yourself most of the time, but we want to know what happens in the case of a chronic condition and what happens, who has to do what, and what options there are. Now, by the way, one more thing about this Medicare and Medicaid thing, I forgot to tell you about this 5-year look back period. Some individuals believe that, before they get any of this care here, the assisted living or home health care or nursing home, and when that spin down is when they're looked at in their assets, all they have to do is transfer their assets to their son, daughter, or whoever. And there's a way to do this without running amok of the law or getting yourself in trouble. And I'll share that with you later. But just know that for those of you who have assets, it's just not as simple as dumping those assets off on other individuals when you feel that you have, or when it's been shown that you have a chronic condition or a chronic illness that is changing the quality of your life. It's not quite that simple because the government looks back at your assets from 5 years previously, and if you dumped anything, believe me, they'll get it back. All right. Well, anyway, we'll come back to that particular thought. Here are some options to take care of you. Assisted living facilities, and in most of our communities, we can see an assisted living facility really, almost everywhere. They've sprung up like flowers, and they're beautiful facilities sprawled out. And many of those places look very nice, but there's a cost to go into them. And the Genworth health insurance or life insurance company, Genworth Financial, which is one of the companies that I work for and represent, or not work for, but at least I represent in my portfolio of products and services, is a company that has tracked the cost of many of the costs that you'll hear today since 2004. And believe me, their cost assessments and predictions have been spot on over the years. And so they are one of the leading ones to go to when you're looking at the cost of care in your particular area and all of that type of thing. In fact, there's another resource that the government has put out where we can talk about the quality of these particular types of places as well. And I'll talk about that in just a few minutes. But based in these figures that I'm giving you are based on Illinois costs. In Illinois, the annual cost of an assisted living facility, and this is the median average from Chicago to St. Louis, is about $48,000 a year. And that's this year. In about 10 years, that cost is going up to 64,000. Now, what about that person that has 63,000 in their savings account or in their retirement account or $90,000 in their 401k? Just in assisted living costs, that money is going to be spent. It's going to be eaten up pretty quickly. It's not going to last too long. Well, that's an assisted living facility. Some people say, well, I'm going to just have a home health aide come in, somebody to take care of me. They come in at a modest price. Well, for an in home full time care home health aide, which many individuals that when they go this route, they need that full time care, either transfer to eat, bathe, or whatever the case is. In 2018, that will cost about $51,000 just on modest, just the median average in Illinois. In about 10 years, that's going to graduate to about 69,000, nearly $70,000 for a full-time in-home health care aide. Okay. So again, that's putting a strain on savings. Now, this is just to take care of your health. I want you to be reminded these numbers are just to take care of your health. We're not talking about what it takes to live, to eat, to pay other bills. We're just talking about health care. I hope you can understand or see the problem as I'm kind of outlining it here, because this is a great number of dollars that we've often been encouraged to save for retirement, and now our retirement could potentially be eaten by extended health care. Now let's look at the nursing home. And I don't even want to bring in the private room costs. Let's just look at semi-private room costs. I was surprised and shocked by this myself because we've had the experience of having to take care of or be partially responsible for my mother-in-law some years ago. And as we looked at costs over the years, even up until this particular time, the costs have tremendously jumped. In 2018, the semi-private room cost of nursing home care is about $70,000 or $195 per day. In 2028, just 10 years from now, that cost is expected to jump to $95,000, nearly $100,000 a day in just 10 years. And these estimates have been since 2004 spot on, and they're probably going to be spot on in about 10 years when we look back at this particular presentation. So, as we can see, this is money. There's some of you have saved $100,000 or $200,000 in your retirement account. But if we look at this, there's about $100,000 in 10 years. Something happens to you. There's about $100,000 that's going to go out in just healthcare expenditures. This could potentially be a financial devastating problem. You're saving money, but the facts are that that money may not be there to pay for other things when you reach a point that you need care or you need help. Well, I've laid out the problem here. The problem is financial drain. The problem is expenditures for potential extended health care that could be off the chain. The problem is that there could be a very serious situation where there may not be enough financial resource to take care of your extended care, your health care in the event of chronic illness. The problem is that there may be confusion. as to who's going to do what, who has to take off their job, what type of schedule, who has to not get educated that's on their way to be educated as a result of a chronic or extended illness. And let me tell you what, uh, don't think that it cannot happen. Over the last year, I've witnessed individuals that have had uh, life threatening situations happen to them. They have entered into the realm of chronic illness. Some have had strokes. Some have had other conditions come upon them that dramatically altered their life. One particular situation, and I am a minister, but I don't want anyone to think that this doesn't happen to ministers. Yes, it does. I know a particular pastoral friend of mine who suffered from a major stroke this year, and he will not pastor again, barring a miracle of God, which we certainly believe in. But he will not pastor. He's in the condition to where he has to relearn. He barely did survive, but there's many different things, many different troubles that he will have, and he is not expected, let me say it like that, to ever pastor again. We've seen school teachers, school principals, that some young that have had issues health wise, and they cannot perform, they cannot do, they've had to uh, draw themselves out of the workforce because they cannot work anymore. We've seen mental stress, mental illness come upon individuals, dementia. They cannot think and perform, and they're medically diagnosed as having a mental problem that where they're a threat to themselves and a threat to others. I've seen that in my experience. So one can't tell me that it doesn't happen. It happens. So those are the problems that we've outlined here, but there are some solutions, and we can only solve the problem that we know that exists. Anything unknown, we can't solve that problem, but something that is known, we can address the problem. And I propose to you that we can address the financial considerations associated with extended healthcare arrangements. How have we approached this thing traditionally? Well, kind of big there. We've approached it traditionally through opportunities to self-insure or to insure through traditional long-term care insurance. I'm sorry about the presentation problem I'm having here. Usually always have it on this screen. But traditional long-term care insurance has been the way that we've kind of addressed these issues. Or if we haven't addressed them, we've also used a self-insurance route, because that's basically what that is. For you not to address it, you're basically self-insuring or doing a variation of that, and that's called the wait and see. Let's see what happens. But let me just talk about some of the advantages and disadvantages of these approaches. Number one, if you do self insure or go through the wait and see, uh, you're going to basically create havoc. You're going to be subject to spin down 100% of the time. And also, you're going to create some potential family heartaches. I'm trying to get that in the screen there. So the self-insure and the wait and see is basically the same thing, but now you leave your family scattered. Nobody knows what to do, and those individuals have to take the time off of their jobs and or their life, stop, put on hold to take care of your particular situations. I don't know of a parent that's listening to me today that wants their children to not get an education because something happens to them, or to stop serving their families, or pursuing their career or their dream in life because something happens to them as a parent. I don't know of anyone listening to me that wishes that for their children, but that is a situation. If we wait and see, that's a situation that we'll put them in. I prefer and encourage you better to address the issue, and we'll give you a couple of options. The one issue here that we're talking about is traditional long term care insurance. and the other one is chronic illness life. However, we'll look at traditional long term care insurance just for a second here. Now, as I said, I've been in the industry for a number of years. And traditional long term care insurance has been a part of my portfolio of offerings. And I've offered them through many of the top or the major companies in the country that offer these particular products. In fact, you'll only deal with the best companies dealing with Dunamis Insurance and Business Services. You only deal with A rated or higher companies by independent ratings analysts and agencies. So this is, the air that we breathe or the waters that we swim in. Traditional long term care insurance comes in a form that is called qualified insurance. Qualified means that that insurance has passed the governmental outlined standards and codes in order to be a bona fide long term care insurance plan. And in that particular plan, there is a little tax deduction or a major tax deduction, depends upon the premium. So the tax deductibility helps to make the plan affordable. A good way to do it, up to a certain extent. That premium can be tax deductible. And again, I'm not an accountant, but you can consult your, not insult, but consult your tax advisor for information on that. So that is the biggest advantage of traditional long-term care insurance. However, there are a few things that make traditional long-term care insurance a problem. Number one is the cost or the price. As we can see, traditional long-term care insurance could be a little bit more expensive than normal or traditional insurance. It's a more heavily weighted or pricier game or piece of insurance to have. Then there are rate increases in just about all of my clients, many of whom have never used their policies. There is yet annual rate increases that occur for traditional long term care insurance. And nobody, I mean, nobody likes those rate increases. But the worst part of traditional long term care insurance, which is a good idea to address it, but the worst part of it is the use it or lose it. In other words, if you don't use the policy, if you don't get sick, ill, or suffer from an event, you could very well have paid for the policy, and the policy doesn't pay you if you die. The policy doesn't pay you, or if it cancels, there's nothing back that you get. So it's use it or lose it. That's the worst thing about traditional long term care insurance, and why many of you have been told, don't worry about that. Just get on over it. And it's almost like, close your eyes, and if you don't see it, it won't be a problem. Well, guess what? Just because you cover your eyes, like some kids do. Some of my kids, we've had a daycare. Some of the kids, they put their hands over their eyes and they pretend that if they don't see it, it's not real. But unfortunately, these type of situations are real, if whether we see it or we don't. So this is the traditional route of addressing these issues. Now, I want to look at a little alternative, and that is called chronic illness life insurance. Okay, many of you have never heard of chronic illness life before, and so I want to share this with you today and give you some food for thought and consideration for planning in this particular area because I believe it's vitally important. Now, there is a difference. Chronic illness life insurance is life insurance, just as the name suggests. It is not health insurance. Okay. And that's a good thing. And I'll share that with you why that's a good thing. From number one, an underwriting standpoint, life insurance is underwritten differently than health insurance. So that is could be an advantage to an individual, could be an advantage to you that are seeking. If you have a condition where you would be disqualified for health insurance, sometimes, depending upon that condition, you will qualify for life insurance. Now, the life insurance I'm talking about has a chronic illness benefit built into the policy. a chronic illness benefit or a health benefit built into the policy, but the policy is basically underwritten for life insurance. So make no mistake about that. We're not selling a revamped health insurance plan. We're providing a chronic illness life insurance plan, a life insurance plan that covers chronic illness. Now, with that said, there's a few things that happen just by nature of the life insurance itself. Number one is price stability. In other words, don't worry about any of those rate increases anymore. For those of you who have long term care plans, especially if you've had them for a short period of time, this is the number one reason that you need to give me a call, is because I can offer you price stability now through any number of the handful of companies that does this. Whereas the long term care insurance, no matter who is your long term care cover carrier, that price is going to jump. Second thing that I can offer through a chronic illness life plan is death benefits. In other words, if a person is paying and something happens to them, God forbid, and they pass away, now there's a death benefit that happens, and there's a death benefit that is paid out from the insurance company. Another thing is that the policy will automatically go into a multi use mode. In other words, we buy it for a number of things. We want it to turn into a chronic illness, safety net for us. But at the same time, we want to buy it for a life insurance benefit too. But the policy, without you saying anything, automatically changes from a life insurance policy to a chronic illness benefit policy, and it will do those type of things based on your particular condition. And there's no additional underwriting to make any of these things happen. Once you're in, you're in. The door is closed. There is also a cash return available within the policy. Most whole life insurance policies, which this is the chassis, is a universal life of chronic illness life, produce cash values along the way. Now, this varies from company to company. And as I said, there's only a handful of companies in the country that do this, and we are contracted with over 80% of those companies. But there's normally a cash return benefit. And so your net cost generally decreases over years. Now, I know you've been told by Dave Ramsey and some of the other ones that you should always avoid cash value life insurance and all you need is term. Well, that is not so much as the truth. And we can make a clear and sound argument that cash value life insurance is not only a good financial move for individuals, it is a benefit to your family in the long term in every situation. And you will actually become more financially solvent through cash value insurance than you will through term, because term, you throw the money in there and it goes away. Cash value life insurance, at some point, you'll have either the money back or a portion of the funds back. Therefore, your net cost for insurance will be significantly less, especially in the long run. Well, the same thing works here in the chronic illness scenario. These policy benefits are paid out on one or two bases, either a reimbursement basis or a cash benefit basis. Now, reimbursement works like this, that you pay the bill up front or you produce an invoice so the company can pay the bill, and it gets paid that way. Either you get paid back or the company pays by invoice. Or there's a cash benefit arrangement built within the chronic illness portion where the individual says, hey, I need X amount of dollars for this, that, and the other. Don't even have to say what it's for. You have X amount of dollars available from month to month under the policy, and you can receive those monies or those funds without any questions. That's a cash benefit policy. We just happen to represent companies that do both arrangements, either reimburse or provide cash benefits. Then the another advantage, generally speaking, and again, I'm not an accountant, not representing myself as one. However, you would speak to your accountant about these particular benefits, is that there are tax-free benefit payments because of the nature of the insurance. If an individual is chronically ill and is receiving payments, reimbursements, or cash benefits, guess what? They're receiving benefits tax-free, and also death benefits because it's life insurance. According to IRC or IRS regulations, death benefits received from life insurance are received tax-free as well. Now, what does this do? This particular plan eliminates the family pressure, it eliminates the guessing, and it eliminates the state. And that's right. It eliminates all of those things that could negatively work against your particular estate, just and work against your financial health, just by having these things in place. Your family is assured a level of security that now you can receive the care that's necessary, or your family members, if you're looking for this for another particular person in your family, that there will be enough funds there to take care of them, to make arrangements, to do whatever necessary to give them the best possible health care without being forced into a nursing home or without being forced into a facility, but right there at home. And guess what else this policy does? This type of policy does. It actually helps provide funds in most cases under most of my carriers, provides fund for healthcare giver training for those who are family members that are looking to give training for, or get training so that they can take care of their loved ones. And surprisingly enough, 66% of individuals that are experiencing long-term health care, receiving benefits and receiving care, 66% of those individuals are cared for by family members. That's very important because most of those family members are non paid. In fact, only about 9% of those who provide extended home care services for individuals are paid. Only 9%. What you got 66%. You've got most families, two out of every three. If a family member gets sick and ill, you've got families, you've got sons, daughters, you've got extended family, cousins, aunts, uncles, sometimes helping to take care of individuals in these type of situations, but only 9% of those individuals are getting paid. Well, this particular insurance will provide for training as well as payments for home health caregivers. Now, you have to go through and align yourself with the companies that can be contracted with here, and there's a process to that. But there are funds available to train individuals so that they can actually become a part of providing the healthcare solutions and services to family members. So by having either one of these routes, traditional long term care insurance or chronic illness life, a person can actually convalesce at home as opposed to a facility, receive care from family members, and those family members can be paid for their time, and a plan of care can be presented which is comprehensive, and there does not need to be a worry about government spend down or taking money or taking assets. Okay? This becomes vitally important because there are some concepts, and I'll share that concept with you now. The concept here is to use any number of trusts, whether that be a living trust or some other form of trust, in conjunction with these particular type of arrangements. If it is a chronic illness life insurance policy, which we're recommending, that is combined with a trust, then that works the best for everyone, in that a trust can be used to divert assets at the right time to help avoid or minimize the effects of the 5 year look back period, as long as the insurance coverage is in place for the appropriate duration of time, that is, at least about 5 years or longer. So there is a way to do it, and you've got to make sure that you use the right type of trust. You don't want to use a revocable trust. You've got to use an irrevocable trust in order to do that. And assets should be transferred in either by Schedule A or by title. And again, those are things that I don't practice law, I'm not a lawyer, but those are things that you can consult your attorney, your estate planning attorney about, or we can take the lead. If you come to Dunamis Insurance and Business Services, we can take the lead in making sure that these things are set up properly, working with your estate attorney to help implement these particular programs. So, in summary here, what is chronic illness life? It is, make no mistake, a life insurance policy with a specially designed chronic illness accelerated benefit rider within it. This is what it is. All right. Then, what are some of the advantages of this particular policy? Life insurance and chronic illness benefits are normally received tax free. Insurance premiums are guaranteed for life, no fluctuation in those premiums. Here's some more advantages. You have a lifetime or shortened benefit period. And remember, the benefit period is the time for which you receive benefits. If you are diagnosed or your family members diagnosed as being chronically ill, and now they need the replacement, they need help because they crossed the threshold of being having two or more of those ADLs that they cannot perform. Now they can start to receive. That opens up the benefit window right there. That's the trigger right there. That's when the benefits begin, or the time on those benefits begin. Most of these policies have a 60 to 90-day wait, so the clock starts ticking when that diagnosis is made that a person is either by dementia, is chronically ill, or by the inability to perform two out of those seven ADLs. From that particular part, I recommend a benefit period no less than 5 years. However, a benefit period could last 10 years or even on a lifetime or to a certain age. Some that are popular to age 65 or whatever the case is. However, there's flexibility in making a benefit period. And of course, in most cases, the shorter the benefit period, the lower the premium is. Okay. There are extended benefits available. That's almost like having a rider on top of the benefit period. If you have a 2 year benefit period, you can extend that thing out for another 2 years to have a 4 year overall plan, but that plan is available at a discount on that. And again, the professionals such as myself, Dunamis Insurance and Business Services, will help you go through those particular considerations. Then you've got an unrestricted cash or reimbursement benefit options, which I've discussed earlier, and multiple funding options. What if you don't want to pay monthly, but you have a lump sum set up in the bank? You want to do that. You can set up a policy or set up a plan based on that as well. Business owners, those who are in church, church leaders, surprisingly enough, churches don't have, the majority of churches, I know we see a lot on TV, but the majority of churches don't have benefit plans, and certainly don't have these type of plans for their pastoral leaders. About 60% of the churches don't have a benefit plan at all, and even less than that, less than 25 have a retirement plan, and less than that have any type of situation or help assistance if the pastor becomes chronically ill and or sick, other than the fact of raising money on an annual basis to try to pay for some of their expenses, which becomes a very bad way to um, uh, have financial stewardship within the context of the church. Okay, so this is it. Chronic illness life, as we've seen here, is a viable option, a way to address the issues associated with extended health care, to take pressure off of your family, your children, your loved ones, if something ever happened to you, or if you're dealing with a senior in your family, to help them take the pressure off of you from a financial basis as well as anything. If you know the money's there, you can pay for the care. You can do a lot of things, and everybody will feel much better about doing things. It will also preserve assets. This particular planning will help preserve assets to make sure that assets are not drained or taken by the government, or that you don't have to have a fire sale in order to, do, in order to make these things work or to take care of your family members, or, that your assets don't have to be sold in order to even take care of you. So, these are very important situations and very important things here. So, what you do now that you've seen that the potential is, we're looking at the 18 to 64 category, and we're realizing that 43% of people, of all the long term care, is given to people in that category. It behooves all of us, not post retirement age, but pre retirement age, to begin to look at and address and solve this issue, because we don't want to be a drain and or a burden to our family. We want our families to be blessed going forward. So every pastor, if you're hearing me today, I would advise, after you minister to others, make sure that you're ministering to your family in this particular situation. And every family leader or head, mother and father, if you have small children or whatever, give me a consultation, give me a call so that I can consult with you to address these particular issues. The best call that you can make is to give me a call at 309 648 5351. We'll offer you a free confidential consultation, and we'll assess your needs and your family situation and work with you to build the options that you need and a plan to address these particular issues as you move forward in life. We've done this for over 20 years in one level or another, and we are evolving and adapting to the current insurance climate. And that's why you see this seminar. Nobody was doing these type of seminars before, but when we're in living in a day where there's over 10,000 individuals retiring every day, over 10,000 individuals retiring every day, as we can see, social insurance, Medicare, Medicaid, all of those things can only go so far. And we want every family to be benefited and helped, not just, to exist, but we want you to be helped um, by our services, and because we know that there's help out there. So this is the action plan. Give us a call. Let us know what's going on and how we can help you. At this time, let me take a few questions from the chat audience. All right. Yeah, this question comes up and has come up a couple of times as we look at it. AARP is a organization designed to help seniors in many areas, and they are promoting currently, I know in Illinois, the ELECT Act, which would allow individuals to receive paid time off from their employers to help care for a loved one or a parent. Nowadays, if you use the paid time off, the boss or the company does not want to pay you generally for that day. So you end up losing a day's worth of wage. But under elect, you'll be able to take time off and go take care of your loved one, and you'll still get paid for that day of work. And there are limits and limitations on that. By insuring or going through a chronic illness life program, the individual would not have to worry, because that money to pay for a caregiver would be there and would be available. And under the cash plan, an individual could very well take time off and receive cash out of the policy to compensate themselves for that particular day. So the only thing that you'd be mitigating, or the only thing that you would be doing at that particular time, is making sure that you don't exceed the days that you're allowed to go and be fired. You don't want to be fired off the job. So that is something there. But other than that, AARP does not have a long-term care program. They do have a life insurance program that expires at age 80. It's a 5-year term life through a company that I used to work for, and that's called New York Life, which is a good plan and a very strong company. However, I've had many individuals come to me and actually replace that particular plan because it doesn't last long enough, and quite frankly, I can give them a better rate and more stable insurance for a longer period of time. All right, so that's one question that we've had coming up as well. So far as the trust issue, yes, okay. Uh, Again, I'm not an attorney, and I don't want to go too deeply into that area, but I will only say this is an irrevocable trust is used to get assets out of your name. Okay. It has to be done in a timely fashion. You can't say I'm going to Medicaid next week. Let me set up this trust this week and transfer all my assets. Doesn't work like that. There has to be a 5 year look back. There has to be a 5 year period in which that's done. So if a person realizes that they're running into this problem, what you want to have is enough time, a bumper between the time that you have transferred assets to the time that you apply for state aid. Now, I'm not a proponent of applying for state aid, so I don't want you to think or assume by any means that we're trying to prepare you to apply for state aid or Medicare. No, we don't want to do that. We want to avoid Medicare or Medicaid. We want to avoid Medicaid and social insurance programs as much as we can and take control of our own healthcare decisions. Make your decisions yourself. That's the best way to do it because we're living in a day where other individuals, some individuals who, are not, they're not in your family, feel that they can make decisions for you. You don't want that situation. I don't want that for you. So this is why you always ensure these particular situations and circumstances through a chronic illness life plan. And again, we represent over 80% of the companies that's doing this within the country, or at least doing it at a top level within the country. There's only a handful of companies that offer these type of particular plans and benefits. There's all kinds of companies that have little add-ons and they're under the accelerated benefit programs in life insurance, but a chronic illness benefit rider designed specifically for this particular purpose is kind of rare. And we have contracted with, like I said, about 80% of those companies, and the other 20% are not competitive as the 80% that we represent. In other words, we'll beat the ones that we don't have with the ones that we do have in just about every situation and in every case. So we have an extensive database of companies, and we're able to tap into who's doing what in the industry all around. So I want you to know those couple of things. Okay. Um, I think that is the last thing there that we want to go in. All right. Well, thank you for joining me today. I'm over time on this particular seminar, but hopefully that you have been profited by the information that we have shared. Please share this with your family and friends. If you hear it, you're maybe listening. Some of you, if you haven't listened to me live, you are listening to me by way of YouTube. Uh, Please share this with family and friends. Consider these particular things. Give us a call if you have questions or concerns. Give us a call or email us. I'll be glad to respond to your call or your email promptly. All right. Once again, thank you for joining us. Give us a call for your life and health insurance needs. This is Harvey Burnett of Dunamis Insurance and Business Services. I want to thank you for joining us today for this very important seminar. All right. Thank you. God bless you and take care. Until next time.